I actually don't have a presentation.
No, that's fine. Just
we were
your
doing
presentation.
Together. I'm clinical background, so I was here to support Lucy with any questions that may come in.
Okay, all right. I guess perhaps the first one, and I probably should know this, when there should be, or is there allocation for space on Cambourne West for a GP surgery, or is that supposed to be part of what exists already now?
There isn't a allocation for a GP practice on Cambourne West. There is the part of the Section 106 actually allows some financial mitigations towards the practice to support any development coming through. So what that actually means is that there has been some money set aside, that so should the practice need to develop, more clinical rooms, or reconfigure the space to allow for more consulting rooms, then there's been some financial mitigations that will come forward through the Section 106 to allow the practice to do that.
Right, okay. I'm sure there'll be other questions coming in. There's one that's coming on the Q&A session, chat session, shall I say, which is from Charlotte. What provision is planned for NHS dentists? There is a serious lack in the area.
Yeah, Lucy, do you want me to take that? So currently we don't cover dental services under our primary care provision. That's all changing and they will fall under our remit from April 23. I don't have the details, but I can certainly come back to you with some lists that would be helpful to share with your residents, but we don't commission dental services currently at the ICS in Cambridge and Peterborough. It's a bit of a, not a helpful answer, I'm afraid.
Oh, okay.
But we'll certainly go away and we'll bring some lists and information back to you around dental provision for the site.
Okay, thank you for that. Oh, and the next question has come from Stephen Drew, who is another of the three district councillors for Cambourne. So welcome on board, Stephen. And I think Stephen's question says, bear with me, based on the current situation they are in with the delivery of West Cambourne, do the developers believe that they are going to be able to meet all of the commitments made in the planning consents for the site in terms of Section 106 and any other commitments made beyond the basic building of houses? Schools, residents of Cambourne be expecting any attempts by the developers to, did you mean recuse their commitments to the community agreed in the planning process? Does that make sense to you?
It makes sense to me. I can answer if you like.
Okay. Stephanie?
And only to say, Stephen, that we're 30 occupations into 2,350, and we are currently making our contributions for Section 106. This is a really long development. It's going to be another 10 plus years. And I'm not trying to not give you an answer, except to say if a recession comes along, if something comes along that fundamentally upsets the balance of the viability of the site, then we may have to have a conversation with the district county council. That happened in the last housing crisis. And I'm not going to pretend it might not happen again, but it might not. It's really difficult to say when we're only 30 occupations in. And I'm sorry, I can't say yes 100%. That won't. I'd love that if that doesn't happen, but I don't know. But those are the circumstances, and the circumstances in which we can renegotiate the Section 106 are covered by planning policy as well. We can't just say, oh, do you know what, we don't want to do that anymore. There's got to be a real viability reason backed up by financial basis and a financial explanation. We can't just make that decision unilaterally. That's the word I was trying to look for. Andy, sorry.
Okay.
I think Andy from Taylor Wimpey wants to add to my answer.
Yeah, I think also, yes, come over to you then, Andrew.
It's just really just to add to what Steph's just said, really. So all of the Section 106 payments are all already linked to occupations. So from our point of view, one of those really helpful infographics that Steph shared with everybody shows our current expectations based on current climate and housing delivery. Supply and demand is always the name of the game. And from our point of view, that's the full intention. The only variable would be in the event that we either slow down or, of course, speed up. So they're the two main drivers. Steph's just alluded to a kind of worst case scenario where, you know, economic sort of uncertainty causes all sorts of problems. But on the whole, that's a very unusual situation, and invariably things will come forward in accordance with the speed of build.
Okay. Yeah, because that's I think the question has arisen from something that we're going through at the moment, but obviously it is of concern, especially given the size of, you know, the new development and what's going to be adding to the current development. There is a comment here. Please don't forget, you know, put your questions in the chat, but I will be calling on Joe Dwyer, because I know you've raised your hand. But I'll just make this comment. This is from Mike. I'm not sure which Mike this is. Says, it has already been agreed with David Parks that bone surgery will not be taking patients from West Cambourne. I'm not sure if this is something you're aware of, Lucy or Danielle.
Yeah, so we are aware of that, but as we all know with health, things change. So, you know, while that is currently been an agreement, we would take things on a case-by-case nature at the moment, because what we don't want is people left without healthcare provision. So we are aware of that, but you know, I would say, please, sometimes we have to have other considerations. So I don't think that's a blanket, you know, set in stone agreement. We would talk to the practice if and when we needed to.
Okay, but bear in mind that already, you know, the practices that serve this area are quite busy. They're quite full. My family is registered with bone, so I know exactly what, you know, what they're going through there. Joe, would you like to ask your question now, please? Are you still there?
Thank you, Chair. You're just unmuting. Can you hear me okay?
That's okay. Yes, I can hear you.
It's a couple of questions for Lucy and Danielle, if I may.
Okay.
You spoke about the need for prospective new residents of West Cambourne to be registered or to be aware of the registration process beforehand. How are you facilitating that process? How are you making them aware? Are you, for instance, making the process aware to the sales staff and the sales officers at West Cambourne? So as prospective residents come in, they could say, here's a form, you need to be aware of this process. And if you're going to buy and live here, you want to try and register it in the area beforehand. Otherwise, people won't know till they move in, with a doctor, where do we go, how do we go about it? Because West Cambourne, some kind of residents already complained about the difficulty and the lack of knowledge in who and how to register with a GP in this area. So,
yes. Sorry, Lucy, I don't know if you know, we've had any direct comms with the sales teams, but it's a process for everybody. I mean, you can't really register a new practice with an old address more than kind of 4 weeks beforehand, but it's things like making sure that people are not going to be out of medication for long periods of time.
And I understand. Lucy did say that it's useful for people beforehand to
Yeah.
be aware of the process. I'm just wondering how will people know? Unless that process is made familiar to them, they won't know it.
So I can pick this one up, Danielle, thank you. So what we are aiming to do, and I think it's an indication, as I think Stephanie's already mentioned, this is at a relatively early stage of this development. We are looking to work with the local authority, with the developer, to put together a communication pack, and we are working with a colleague actually based within South Cambs District Council to agree what those comms are and to add that information. So this is a a project that is actually in train at the moment, and once we've got clarification and agreement around the comms that will be going out, again bearing in mind, as Danielle's already said, we have to make sure that whatever we put out around communications is in line with what the practices is, agreeable to the practices, as well as make sure that it complies with the governance, that everything aligns. But this is certainly something that we are looking to progress with within the next sort of couple of months or so. We've had to pause slightly.
Sure, I take your point, but with respect, if you already get 30 residents already living on site, that should happen beforehand. It shouldn't be at this point. Exactly. The other point I wanted to make was you spoke about registration. It's already been made clear that Bourne isn't going to take any new patients. Monkfield practice is largely oversubscribed, and the S106 you spoke about will provide for capital build, but what we actually need is more GPs. There's no money for revenue in the S106. So is that something the clinical commissioning group will look at to provide more GPs in the practice to cope for the extra 2,350 houses that will be being built in West Cambourne? Because clearly it's no good having consultant rooms and a large building without GPs to staff it.
Yeah, Joe, you're absolutely right. We need more nurses and GPs and all of our other allied health professionals across the patch. If we had the ability to allocate GPs to a practice, we would be very happy. But if we have to balance with what we've got and what we need. So we don't have a list of GPs anywhere that we can allocate to a practice.
So what I'm talking about is, so obviously that planning for that need is at this point be discussed, and our additional GP services and nurse services will be imported into Monkfield medical practice, which, as we know, the S106 money is going to provide for quite a substantial enlargement. So it's more about forward planning, really. So we don't wait until the busting down with potential patients, never to turn people away before someone says, actually, we need more GPs and nurses here. It's known at this point in time there is a need. So is that being planned for now?
Lucy, I don't know if you've got any more info around that planning, but as far as I'm aware, we know the growth. It's in the planning, it's in the workforce plans, but NHSE workforce plans across the whole system are really complex at the moment. As I say, we just don't have enough of any of our allied health professionals to cover what we currently need, let alone with growth. So it is certainly high on our priority list.
Could I just reiterate the need for dental services here? There is a post that you've NHS dental.
Sorry, Joe, I need to come in here. We need questions, just specific questions, please.
Okay, so you mentioned about.
We're aware of all the situations. We just need specific questions so that they can answer the questions.
Well,
Thank you.
can I ask what you're going to do about the poor pharmacy services here in Cambourne? You already mentioned about you taking on dental practice from 1st of April 2023.
So are you talking about dental or pharmacy?
Both. You already mentioned that pharmacy, dental practice will come under your remit from 2023. So presumably you'll take on board and consider the needs there. Do pharmacy comes under your remit?
Absolutely, yeah.
So we have issues with pharmacy here in Cambourne. We need either a larger pharmacy or an additional pharmacy. But I assume you're aware of the issues.
We certainly are.
Yeah. So what are the plans to improve that?
So I don't have the detail of the pharmacy planning, but I can tell you that it is being looked at and it is being reviewed. But we can certainly come back with questions. Growth in itself is being looked at in the whole of our region. We know there's a lot of growth in Cambridgeshire and Peterborough, and we are trying to keep up with that growth with all health provisions. And as I'm sure you can appreciate, it's very difficult at the moment with what we've actually got. But we are certainly well aware of the implications for you as residents, and we're doing our best, and we'll keep you posted with any news that we have.
When can we expect some sort of outcome? I'll finish there, Chair. Thank you. When can we expect some sort of response to that?
Okay. Right. Now, I'm going to step back a bit. There was a question which is kind of related to what we've just discussed, which is that are there trigger points for releasing the S106 for additional GP expansion ring configuration?
Yeah, I'm sorry. I answered that in the Q&A. I'm sorry if that was the wrong thing to do. I wasn't sure whether to live answer or try and type while everybody was talking. The section 106 is linked, yes, to occupations. So it's 970,000 and something. And then that's linked to occupation triggers. So the first payment is made at the 500th occupation, then the 800th, and then the balance on the 1,000th.
Okay. All right. Thank you for that. There was also about ongoing running costs for existing practice. Will that be increased in time with the population growth, or will there be a lag? I suspect there will be a lag, but I don't know.
Apologies, I can't see the Q&A. Sorry, can somebody read the question to me?
I will. It says, what about the ongoing running costs of the existing practice? Will that be increased in time with the population growth, or will there be a lag?
Yeah, so, and again, Lucy, please do jump in. So the global sum that's given to GP practices to run the service in the area is based on their population. So as they increase from 5 to 10 to 50 to 400 patients, their global sum will increase in line with that. And that happens, I believe, twice a year.
Okay. All right, thank you. There was a question about Bourne Airfield's requirement for health. Is that being considered as part of the overall strategy that you're using now?
Fumi, can I comment on that, because the planning application is awaiting determination. I did try and answer that in the
please, Stephen. Thank you.
Message. My name's Stephen Kelly. I'm the Joint Director of Planning for Greater Cambridge. Healthcare provision is being addressed through the Section 106 agreement, which is pending completion at this moment in time for Bourne Airfield, and we'll come to that. Both in terms of a initial temporary facility on site to ensure that there's provision available early in the process for residents, and in the form of a permanent facility to be constructed. I think the trigger point is at around 1,200 dwellings for that process to be underway. So yes, we're engaging with NHS England on that, and I think we've reached a conclusion in terms of the arrangements that are necessary, reflecting surrounding capacity issues that people have highlighted.
Okay, thank you very much, Stephen. And the last question I will take, because I'm just looking at the time now, so we can keep on time, is from Stephen Drew, who says, so are the NHS saying that they guarantee that all new West Cambourne residents will be able to register with a doctor in a practice local to them?
So yes, we are saying that all residents will be able to register with a doctor. What we cannot guarantee to you is which practice that may be, but we would not want any of your new residents left without healthcare provision. Okay.
Thank you. Thank you very much for that, Danielle. And on that note, I'd like to thank all those who have attended this Cambourne forum this evening. And thank you to our presenters and everyone who's answered questions from the panel. We do hope you will join us for the next session on travel and transport infrastructure. Now, I will say this, if you are leaving now, please help us to shape the forum to meet your interest by completing the short post-Zoom questions that will pop up when you leave the meeting. And the time is 6:45. We are bang on time. Thank you very much.
Thank you.